Infant Mortality, the Practice of Bed Sharing Among the African American Population by Sarah DeFelice. The Center for Disease Control defines infant mortality as the death of an infant before his or her first birthday. The infant mortality rate is defined as the total number of infant deaths per 1,000 live births. In addition to providing key information about maternal and infant health, the infant mortality rate is an important marker of the overall health of a community. Sudden unexpected infant death, or SUID, is defined as the sudden death of an infant less than 1 year of age without an immediately apparent cause. SUID is among the top 5 leading causes of infant death. Accidental suffocation and strangulation in bed, attributed in part to the behavior of bed sharing, account for over 24% of SUID deaths and continues to impact the African American population at a significantly higher rate as compared to the white population. Significant disparities exist among racial and ethnic groups, particularly among the African American community. The Black infant mortality rate is over 2 times the rate of non-Hispanic white infant mortality and has not significantly declined in recent years. The social determinants of health contributing to the African American infant mortality rate in conjunction with the behavior of bed sharing are extensive and intermingled. The social determinants of health on the 5 levels include: on the individual level, breastfeeding, child abuse, drugs, education, employment, maternal health, interpregnancy intervals, maternal age, smoking, weight, poverty, prenatal care, and safe sleep. On the family level, paternal involvement, support from friends and family, and intimate partner violence. On the relational level, availability of medical providers and hospital facilities. On the community level, neighborhood effects, concentrated poverty, and racial segregation. And on the public policy level, economic contraction, imprisonment rate, income inequality, offices of minority health, pollution, public health expenditures, and welfare reform. Exploring the relationship between the social determinants of health among all levels of the influence in the ecological model would provide a better understanding of the issues that inhibit Black mothers from creating a safe sleep environment for their baby, with particular attention to bed sharing. The Black community is deeply rooted in family and tradition. This concept demands attention to their belief system in order to create long-lasting behavior change. Implementing the ecological model provides potential for a more comprehensive understanding of Black women's beliefs and attitudes in regard to bed sharing. Understanding bed sharing within the African American community. The theory of reasoned action was used to assess the behavior of bed sharing within the African American population. Attitude was the focus construct examined. Data from the study, done with inner-city Pittsburgh African American families who received Medicaid assistance, indicated 5 themes that explained parents' attitudes about and motivations for bed sharing and intent to bed share. 1, better caregiver and infant sleep. 2, convenience. 3, tradition. 4, child safety. And 5, parent and child emotional needs. The social cognitive theory, with particular focus on the constructs of knowledge and sociocultural factors, was used to examine the behavior of bed sharing among the African American community. Focus groups with African American mothers found that the majority of participants were aware of and understood the content of the safe sleep recommendations. Nonetheless, all of the African American women reported bed sharing with their infants. Providers largely concur that mothers understood the guidelines, but suggested they did not comply largely due to cultural factors, therefore suggested that African American caregivers may be subject to influential cultural norms that promote bed sharing. This study did not distinguish between content and procedural knowledge of the mothers. The constructs, specifically sociostructural factors and perceived self-efficacy of the social cognitive theory, were used to examine the effects of racial discrimination and distress on perceived self-efficacy among pregnant women within the African American community. African American women are more likely to be exposed to racial discrimination and to experience psychological distress compared with white women. Women who reported more experiences of racial discrimination also reported lower levels of social support and psychological well-being. Social support can reduce psychological distress and improve well-being of pregnant women. Therefore, providing pregnant women with positive and supportive experiences may improve their psychological well-being, thereby encouraging increased self-efficacy when it comes to bed sharing practices. Understanding bed sharing interventions used among the African American community. A sample of Georgia parents, after the implementation of a hospital initiative, identified family characteristics and intervention components most closely associated with the knowledge and practice of safe infant sleep, including bed sharing. The theory of reason action was used to guide research through looking at the constructs of knowledge, attitudes toward behavior, and subjective norms. The initiative included all mothers receive infant sleep gowns, promoting the recommended safe sleep position with this side up messaging, as well as sleep baby safe and snug board books. Travel bassinets were given to all Medicaid and uninsured self-pay families in order to facilitate compliance with the recommendations for safe sleep location. Logistic regression revealed that receipt of information in the hospital was significantly correlated with safe sleep behaviors, and infant sleep habits tended to influence safe sleep practices. Additionally, Medicaid parents receiving bassinets from the hospital were 74% less likely to bed share. Modern health campaigns that use fear appeals do so because increased fear, arousal, and perceived threat are often positively associated with recommended attitude and behavior changes. In one meta-analysis, safe sleep public education campaigns were examined to determine the extent to which they continue to focus largely on risk of prone sleep and bed sharing, or whether they attend to a broader array of protective factors like breastfeeding and room sharing, and risk factors such as smoke exposure, parental substance abuse, and hazardous spreading. Frequency of fear, guilt, and blame messages were measured, as well as campaigns targeted or tailored to priority populations such as African Americans who are at elevated risk for SUID. In general, fear-based messages are most likely to be effective when paired with efficacy messages, and that they work better for one-time behaviors rather than for repeated behaviors. Given the repeated nature of infant bedtime practices, there is arguably support for the use of positive or gain-based rather than fear or loss frame messages to promote safe sleep. Community-based baby showers and other group education events for pregnant women who have been shown to promote self-esteem, reduce feelings of isolation, and allow learning from the experience of others. The Kansas Infant Death and SIDS Network, with help from the Wichita Black Nurses Association, implemented community baby showers in an effort to decrease infant mortality. These events are targeted at African American, Hispanic, and low-income expectant or new moms in Wichita. The main goal is to provide education on safe sleep. Participants also receive tools needed to create a safe sleep environment, including a safety-approved portable crib, which promotes having infants sleep alone and not with caregiver in bed. Mothers who attended the showers showed improved knowledge about safe sleep and the intention to provide a safe sleep environment. The mothers in attendance were in the pre-contemplation and contemplation stage. The increased self-efficacy gained by receiving safe sleep materials guided them forward in staged movement. In addition, the community event provided helping relationships which utilized community members in a supportive way to promote the behavior change. One of the constructs of the social cognitive theory is socio-structural factors, which includes practicing cultural competence and utilizing tradition and norms. There are a growing number of interventions that incorporate cultural norms and family traditions to encourage safe sleep practices. The National Center for the Review and Prevention of Infant Deaths is collaborating with the International Association of Indigenous Aging to work with elders in several American Indian tribes in Michigan. The premise is that the elders in the community are trusted sources of information for parents. Elders learn about safe sleep messages, discuss how their own traditional practices align or do not align with these messages, and then develop strategies such as talking circles and traditional craft making to engage with young American Indian parents. This example of an intervention to reduce sleep-related infant deaths, including bed sharing, incorporates a social cognitive theory constructs of socio-structural factors and knowledge. The constructs of perceived self-efficacy, outcome expectations, and goal formations could be included dependent on the strategy chosen. For instance, talking circles may increase a mother's perceived self-efficacy, teach her strong positive outcome expectations, and encourage goal setting with the help of an elder in her community. Applying this type of intervention within the African American population may have a similar benefits, as these two cultures share common SUID and infant death rates, as well as tradition and cultural norms. Bedtime Basics for Babies was a free crib and safe sleep educational intervention. A portable crib sheet, wearable blanket, pacifier, and safe sleep education were provided to low-income families whose infants were at high risk for SUID. This included the majority of participants from the African American population. The primary objective of the Bedtime Basics for Babies program was to provide a safe crib to mothers who otherwise did not have access to reduce the prevalence of bed sharing. After receipt of the crib, 90% of the mothers responded that their baby slept in the crib. This intervention incorporated the component of content knowledge through safe sleep education. However, without exploring additional constructs of the social cognitive theory, including perceived self-efficacy, outcome expectations, goal formations, and sociostructural factors, a long-lasting behavior change may not be achieved. Incorporating multiple levels of the ecological model is vital to implementing a comprehensive intervention that will promote and sustain behavior change. Special consideration to the family level within this population is crucial due to strong beliefs and social norms associated with culture and tradition. The social cognitive theory proves to be a successful model to use when applied to African American women, changing behavior of bed sharing to ultimately decrease suicide deaths and disparity. The social cognitive theory is not often utilized to look at bed sharing within this community to develop interventions. However, due to the strong tradition and cultural norms coupled with family influence, this model incorporates constructs directly related to this population. These constructs include knowledge, perceived self-efficacy, outcome expectations, goal formation, and most importantly, sociostructural factors. A construct of the structural model of behavior is availability accessibility, which suggests that behavior is influenced by access. The greater the access, the more likely the behavior is to occur. Thus, crib distribution to low-income African American caregivers has been shown to increase the likelihood of baby sleeping alone as compared to in bed with caregiver. The name of my chosen intervention is Kiss Me in the Morning. It is a grassroots community intervention. The intervention has two focuses: social media campaign and peer support program. The ecological model is used to address the individual, family, and community levels within the campaign. Instagram and YouTube are popular social media platforms with young adults and therefore will be primarily used. Facebook ads will also be used to capture older family members and friends. Geofencing techniques will be used to target African American families. The Instagram posts will include invitations to join virtual discussion groups for parents based on safe sleep practices and will be led by a peer mentor model from techniques such as American Indian talking circles. All messages will be culturally appropriate. For instance, according to one study by Matthews, health messages promoting safe sleep practices as a way to prevent suffocation from bed sharing may resonate more with African American families than messages promoting the same practices as a strategy to reduce the risk of SIDS. Additionally, the messages will be game-based versus fear-based. The primary call to action is directing viewers to the Kiss Me in the Morning website. On this website, they will be able to access culturally appropriate information on the Kiss Me in the Morning peer support program, community resources for free kids, for free cribs, and information on safe sleep, which includes bed sharing. The social cognitive theory was used to develop the peer support component of the intervention. The intention of using peer support to increase perceived self-efficacy commingled with procedural knowledge and sociostructural factors. The peers will be from the community and trained on procedural knowledge concerning infant mortality, suicide, and bed sharing, along with ethical and cultural factors within the population and behavior. Vicarious experience is a method of learning within the social cognitive theory and is the basis to use peer-to-peer teaching and modeling. The social cognitive theory constructs that will be focused on are sociocultural factors by incorporating family and friends during peer sessions and conducting community outreach events, procedural knowledge by modeling safe sleep techniques and talking about bed sharing, perceived self-efficacy by using a peer-to-peer method. The peer mentors will have free cribs available for distribution to families in need as guided from the availability accessibility construct found in the structural model of behavior. Ethical concerns. Expectations for infant sleep development and for the appropriate degree of parental proximity for infant sleep are culturally weighted in historically shifting aspects of parenting behavior and are known to affect breastfeeding prevalence and duration. The African American culture supports and often practices bed sharing when breastfeeding. The current recommendation from the American Academy of Pediatrics advises against bed sharing regardless of culture or breastfeeding status. This creates an ethical situation which may be implicated by an implicit bias surrounding the African American community and their prevalence of being at high risk to safely bed share. This is an area which needs further consideration and recommendations, as the African American community has lower rates of breastfeeding than Hispanic and white women, which contributes to disparity. Thus, breastfeeding initiation and duration should be promoted within this population.